Hello, everyone. Thank you for joining today's briefing on implications of the midterm elections for healthcare. My name is Christopher Holt. I serve as the Vice President of Policy here at the Alliance for Health Policy. For those of you who are not familiar with the Alliance, I want to welcome you. We're glad you're here. We are a non-partisan resource for the policy community. We're dedicated to advancing knowledge and understanding of health policy issues and doing so in a collaborative way that brings all voices to the table. Today's briefing is brought to you with generous support from NICM, the National Institutes of Healthcare Management, so we thank them for that support. I also want to flag for you that you can join today's conversation on Twitter using the hashtag AllHealthLive. You can also follow us or tweet at us at AllHealthPolicy. We are also on Facebook and LinkedIn and would be happy to engage in conversation there as well. Today's panel is also going to include audience Q&A, and so please be thinking about questions that you might want to ask. We'll try to sprinkle those in throughout and have some at the end. So you should see a dashboard on the right side of your web browser. There's a little speech bubble icon with a question mark, and you can use that to submit questions for the panelists. You can do that at any time. You can do that now. Our team will be collecting those and curating them for me. And so, and then they'll be passing them along to me during the broadcast. Throughout the webinar, if you have any technical difficulties, use the chat feature and someone should be able to help you. So with that out of the way, I would like to introduce our panelists for today's discussion. Their full bios are available in the webinar materials on our website, so I encourage you to check that out. But briefly, let me start by introducing Sonia Nesbitt, who serves as a senior policy advisor at Arnold Porter. She has over 20 years of experience working with members of Congress and their senior staff. She was previously appointed by President Obama to serve as HHS Deputy Secretary for Legislation, where she oversaw legislative portfolios for multiple government agencies. She is also a longtime former Ways and Means staffer, so wanted to flag that. Next, we have Josh Trent, who serves as a principal at Levitt Partners. Josh manages multi-sector alliances and advises clients across the healthcare sector on federal health policy. He's worked at the White House, at HHS, in the Senate, and for the House Energy and Commerce Committee. Josh specializes in public insurance under Medicare, Medicaid, and CHIP, as well as the commercial health market and the Affordable Care Act. Finally, we have Ipsita Smolenski, founder and managing director of Capitol Street. Ipsita is an expert on legislative and regulatory process. She provides research and policy consulting on a diverse set of topics from insurance to life sciences and biopharmaceuticals. And she is a frequent contributor and expert source for media outlets such as the New York Times and the Wall Street Journal. So today we're going to start our conversation with some level setting that Josh is going to walk us through with some slides. Just to kind of understand the framework post midterms. After that, we're going to turn to the remainder of the 117th. We're going to think about what the midterms mean for the lame duck. And then we will move on and look at the 118th Congress. So Josh, if you would like to get us started, that would be great.
Great, Chris. Thanks. Great to be with you. Let's go to the next slide. We just want to do a quick level set on the leadership and the outcomes from the election. Let's go to the next slide. We have clarity from early November. A few weeks ago, we were all wondering what would happen. Now we know the results. Republicans have won the House. We have a few races, just 2 races that have yet to be called that could give a few more to the Republicans or a few more to the Democrats. In the Senate, we have a very closely divided chamber still. Let's go to the next slide. We have a runoff race in Georgia, as folks will know, on December 6th that will determine whether or not the chamber remains 50-50, as we've seen this Congress, or if it actually flips into Democratic control with official 51. We'll talk about some of the implications for that. Let's go to the next slide. For Republicans, House Republicans are being led by Speaker-to-be, Speaker-elect, potentially Kevin McCarthy, who has not yet secured that vote, but is on his way, eagerly kind of pursuing that. We know these members, and they've been members of leadership in different capacities before. That speaker vote will be scheduled at some point in the future, and there's a lot of interest in what happens there. I think what we've seen historically for other speaker votes is that they eventually gain the confidence of their members, and where they are at this point historically in a conference, excuse me, in a Congress, often evolves to get support as time moves forward. Let's look at the Democratic leadership on the next slide. On the House Democratic side, they actually have deliberations underway today, where Representative Hakeem Jeffries was just elected the next Democratic House leader. We're seeing kind of a new cast of characters from the current leadership, with the exception of Representative Clyburn, representing, as folks are saying, a little bit of a generational change. Certainly new leaders who are not new to leadership, but new to these positions, looking at how to navigate a closely divided Congress moving forward. Let's go to the next slide. In the Senate, it looks relatively similar to what we've seen before, with Leader Schumer staying in as majority leader. There's still some decisions to be made about potential assistant Democratic leader, and leadership votes there will be coming in the next week or so. So we'll know more about what those roles look like and who's officially occupies those seats when the final deliberations are made. Let's go to the next slide. In the Senate, Republicans, it's largely status quo. Leader McConnell was challenged briefly and retained his control of the Republican conference, and that looks to be fairly predictable for the foreseeable future. Let's go to the next slide. And then just as a quick highlight, there are Democratic and Republican campaign committee leads. These are important just to highlight because the policy gets done in the context of the politics, and these members and their views and their opinions will be important in shaping the political environment and the policy agenda for the next Congress as well. With that, I think that's all of the slides.
Great, thank you, Josh. And Sonia and Sita, if you want to join us on camera. Appreciate that level setting, Josh. Sonia, one of the things Josh mentioned was the upcoming Senate Georgia runoff. And I think that there might be a sense that, look, Democrats have the chamber control regardless of what happens, thanks to Vice President Harris. And so this may not be as significant a race, but I wonder if you could speak to the implications of that race for how the Senate operates.
Sure, and thanks so much for having me. I got to tell you, I think I and my fellow panelists are old enough to remember when, an age when we were all complaining that 56 or 54 members in the majority wasn't enough. And here we are now today going, oh, but if you get 50, do you really need 51? You definitely do, and it matters for committee ratio's sake, right? I mean, that's going to determine how many people are sitting on a committee, how much or how aggressive I would think Democrats can be in terms of moving legislation through committee and onto the floor. Keep in mind, with all due respect, we do on the Democratic side, I'm a member of that party, still have Senator Manchin and Senator Sinema to deal with as well, in terms of some of their thoughts on what should move forward, and having that extra seat obviously would be helpful if you should lose one of those if you're Chuck Schumer. So, I think it matters a great deal, frankly, again, because it's going to dictate just how aggressive, if you will, the Senate Majority Leader might be, as well as the committee, the chairman and chairwomen might be in terms of advancing legislation.
Yeah. There are also, as part of the power sharing in 50-50, right, there are also limitations on what can get to the floor easily because of that, right? That would be resolved.
Absolutely. That's exactly right. And now we've been in a scenario where the committees have been under the 50-50 ratio. They've been equal number of members on each side of the aisle. So again, committee votes have been impacted by that. It impacts what can get to the floor. But again, that gets back to the how aggressive can the Democratic leadership be in terms of advancing their priorities and priorities that they want to advance on behalf of the Biden administration.
Okay, thank you. Ipsita, we can't see you right now, but hopefully you can hear me. Can you hear me?
I can hear you.
Right. We'll just go with that. So there's also going to be oh, there you are. There's going to be a lot of shifting on the committees. Obviously in the House, it's just you've got ranking members and chairs flipping, but there's also some new members coming in at chair and ranking member on both the House and Senate side. I don't think we know yet who Ways and Means chair is going to be. There's also going to be new members coming onto the committee. So I just wondered if you could speak a little bit to kind of where you think some of the most significant shifts are. And yeah.
Awesome, sure. And by the way, thanks for having me. So let's see, I would say thinking about, of course, the committees of jurisdiction. We know what the entities are, of course, in finance with Ron Wyden and Mike Crapo. You know, I would say on the health committee, we've got Bernie, you know, somebody who wants at one time Medicare for all. So that'll be a big shift. I don't think that'll happen anytime soon. But of course, we know Bernie also is a proponent of drug reimportation. So on the health policy side, I think those are two things to think about. You have Dr. Cassidy, who, you know, is a proponent of dual eligibles, managing those very vulnerable Medicare and Medicaid enrollees. You know, we've got a big redetermination event that's going to be happening after the PHE ends. You know, what happens to those folks? So I think he wants to see a bit of a more streamlined care management plan for the duals. About 6-7 years ago, a dual eligible plan was kind of sought, and I will say, like, several years in, everyone thought, well, gosh, what happened? A few states dabbled, did some demonstrations with CMS, but I would say that more can be done with about the 9 million dual eligibles in our country. Big opportunity financially as well for the health plans. And then, as you mentioned, there's a bit of a fight for Ways and Means, and you know, energy and commerce. You know, I think that a couple of areas I'll just briefly mention of bipartisan interest that we think could see some airtime, and even with the passage of a few bills over the next 1 or 2 years, kind of taking the longer view. Mental health, behavioral health. We think that certain packages and ideas will move across the finish line again, perhaps in chunks, 2 or 3 bills over the next couple of years. Telehealth, of course, is something that the genie is out of that bottle. We learned so much of what we can do during the public health emergency can be done with an iPhone, with a smartphone. So that will certainly continue in some form or shape as well. I know we have a section on the lame duck, and I'm a little bit less bullish on a big package of healthcare policies passing in that kind of mid-December, late December timeframe, but that'll be an interesting package to watch as well.
Yeah, so you brought it up, so I think maybe we can shift to that, and I'm going to ask a relatively broad question, and I'm going to let the three of you kind of take it where you think is most useful. But yesterday, the 4 congressional leaders met with the president. They discussed the end-of-year priorities. Obviously, I think the president wants some COVID funding. Let's see how likely that is. We've got our CR running out in a couple of weeks. So as we think about the lame duck, particularly with an eye toward health policy, what has to happen, what can happen, and what just isn't going to happen, and how have those categories shifted as a result of November? Maybe we'll start with Josh, and then we can just kind of go around the table.
So let me tackle that, what has to happen. We have a couple of Medicare extenders that are typically bipartisan in the have to happen category. Medicare physician fee schedule payment issues that there's a lot of interest on a bipartisan basis that I've heard staff put in the has to happen category. There's a lot of interest in Medicare telehealth, and I would also put that in the probably has to happen because Congress threw themselves a little bit of a boomerang. They did an extension and it's come back to you know, the point where they need to be able to deal with that. And then certainly to your point, Chris, on the appropriations front, the appropriations are always important. We often focus in the kind of popular press on keeping the government open and what the horse race looks like in terms of the political machinations in the deal. I think all the appropriators would tell you, and all their staff would tell you, it really matters for a lot of very bipartisan healthcare priorities around what's the level of funding and what does the conference report look like, or the committee report language kind of look like that instructs NIH and CDC and HHS around so many priorities that are important to the appropriators, that the appropriators support, that they monitor. There's a lot of oversight through the power of the purse there. And I think that is something that often gets a little bit overlooked, but will be very important. And then a Medicare kind of sequester PAYGO issue to deal with as well. So I would put all of those in the have to happen, and then we can talk about, you know, what might, could, should, will happen.
I can hop in on kind of the some of, you know, I guess it's sort of in flux, but I would agree with everything that was just said by Josh, of course, in the kind of must address category. I think that, you know, look, there's always the bits and bobs, the policies that are getting, you know, asked to be added. You know, the dialysis providers, LDOs, were dealt a bit of a blow with the Supreme Court decision in June, and have some legislation where they're trying to get that included. I think CBO has not been very kind on some of these provisions. So if that has a big price tag, thinking it probably won't go. Telehealth, I think we just talked about that, but I think a 1 year seems to be what the consensus is thinking, you know, about extending that telehealth benefit for about a year, again, post PHE. Gosh, what else? Hospital at home, I believe that has a very favorable score of 0, which, you know, helps when you're trying to get something tucked in. The specialist physicians were dealt a bit of a blow in the final CMS rule. I don't think this was a surprise to anyone from the regulatory side, but perhaps I would put that in the maybe category of things that go in the lame duck, and maybe not a full restoration of payments, but like a little bit. And I guess I'll just end with that. Clinical labs actually is something, you know, there's a bill called the SALSA Act, very catchy acronym. That also, I believe, has a decent score on it, so unlikely to get attached to that end of year package, but perhaps a delay. And this is the PAMA Act of 2014. The labs have been pretty successful of getting delays, at least on data collection in the past, so we could see that happen again.
Sonia, you're nodding a lot. You want to jump in?
Yeah, no, I think on that dialysis part, I was just going to point out too, I mean, there's still some stuff on the user fee authorization side that, is it likely to happen? Who knows? But there certainly is a great deal of interest to get it done, particularly related to accelerated approval, clinical trial diversity, and all the other riders that people would like to add onto the bill, things that didn't get done as part of the earlier bill in this area. So just adding that into the mix. Now, granted, as we've all said, that's a long list of things, and the window to get it done is narrowing out, you know, each hour as we go along. So we'll see what happens.
So I think we touched on this a little bit, but what maybe, you know, I remember talking to a few folks on the Hill, you know, a month ago, and right, the number of asks, the number of things that people were hoping to see in this end of year package was pretty extraordinary. Kind of what has definitely fallen off the table because of the midterms, or have the midterms not really had much of an impact to anyone? Sorry.
I'll jump in. I mean, and I'll test this theory. It's a test that, you know, I don't, the midterms, obviously the Democrats exceeded expectations. I don't, given the narrow majority of the House will go, Republicans will go in with, I don't think that has abated any desire for our members on the Democratic side to get things done, or to move things forward. We still have members who are retiring. We have members who are leaving and who want to see and who want to get things done. If you're a House Democrat, you have the gavel now. Now is the time to get anything done, particularly if it has a cost. I'm not going to speculate about whether or not your House Republicans are going to sort of turn a blind eye on getting some of this stuff done, you know, clearing the plate, if you will, for things that they probably are amenable to but don't want to do on their watch. But I don't think the elections change the desire to want to add a ton of policy riders to the appropriations bill. Again, we still have Leahy and Shelby retiring in the Senate. The appropriator Cardinals on that side, they're going to want to see things done. You're just going to, I think, continue to see a lot of appetite from folks just to continue to move forward. The question just becomes how big of a package, and I think that's dictated about how much time they have. And if they can get to an agreement, even on the top line number of an appropriation package, which hasn't happened yet.
So we have a question from the audience, and that question is basically what about the mental health bill that passed in the House that Wyden wants to do? What are the likelihood of that moving as part of either standalone or part of the omnibus?
I can start here. I think a lot of the workforce authorizations have a pretty good shot at again getting passed by the end of the year. SAMHSA, HRSA, etc. I think what the questioner is asking about, perhaps the bill that just got a CBO score, I think right ahead of Thanksgiving. I mean, those seem like relatively access to more outpatient care. I think there was about $10 million for CMS to take a look at the prospective payment system for inpatient psychiatric facilities, which is something that MedPAC is talking about too. So, I'm not a Republican, I'm not a Democrat, I'm pretty much squarely in the middle and certainly a capitalist. Those seem like policies that could go at some point, perhaps not by December 16th, or if they do a CR to the 23rd, by the 23rd. But I guess, we do a lot of mental health, behavioral health work and value-based care work. And we could see some of those things going. But again, if you put a gun to the head, I don't know whether it goes by the 16th or the end of the year.
Yeah, I think I'll just flag one other dynamic to build on what Sita said. Part of the way to think about what gets attached is the appropriations pieces obviously count on the top line. You have some discretionary policies which may or may not cost, and that's typically millions, not billions, maybe cumulatively billions. Some of the Medicare, Medicaid policies are very substantial. So that really often depends on bipartisan agreement on offsets, which the committees work with leadership on. So part of, I think, what you're hearing us say, Chris, is, it sounds like an out, but it depends. And it depends on the agreement that the members have, that the leaders have, that it depends on when some of these decisions get made, because as we all know, you need time for the committees to work, you need language to be written, you need CBO scores, and a lot of that is done at this point, but you still have to have time to stitch bills together and put language together and get CBOs blessing that the math works. So the timing piece is really important, and if Congress gives itself more time, as some have suggested, that might be a signal that, to Sonia's point, there's still willingness to get some interest in getting something bigger done, and there's still time on the clock to get something done.
Great, thank you. I think we should probably start to move towards next Congress, but we have one more question from the audience on the lame duck, and so this is specifically about the provision in CARES that allows employers to offer telehealth services prior to the deductible. That's ending at the end of the year. What is the chances that that gets extended in the lame duck? If anyone wants to take that.
That's a good question. I'll defer to Sonia and Josh if they have thoughts.
I'm gonna send that potato to Josh as well, because that is a really great question that I just don't have a good sense of.
Yeah, it is a good question. And the reason I was quiet is I think what's interesting about CARES is members voted for a lot of things in CARES, in the CARES Act, that was extremely bipartisan. Over time, there have been different ways to think about some of those provisions of policy. So one rubric to often think through is, does something start bipartisan? It usually stays bipartisan. CARES, I think, is a little bit of an exception to that rule, and I don't have a good sense of how committees are thinking about that and where members are in it. I think there'd be a lot of support. Does that support actually translate into kind of deep, broad bipartisan support? So when committees are working with leadership on cutting a final deal that gets done, I don't have a great sense of that yet. And maybe what this all suggests is that individuals interested in that provision should make sure they're in touch with their members that are working on it.
And Josh, I'm going to jump in for the questioner and ask a follow-up. So I agree with everything you said related to the CARES Act, but given the broad popularity of telehealth, do you think that would not make it an exception to that rule, which I think is the right rule? I mean, you're right.
Yeah. Sonia, it's a great point. Yeah, if we put our thumb in the scale, telehealth has got immense wins at its back. And so maybe that means, look, it's a telehealth extension. It started bipartisan. The general climate is towards more telehealth, seems more likely to not. And maybe the fact that we haven't heard a lot of noise on it means there's not a lot of opposition. That's probably a very good interpretation.
Sounds good. Let's pivot to the 118th. So we've got very slim majorities in both chambers, to the point that Sonia was making earlier, that almost unthinkably thin majorities in terms of kind of sort of where some of us have been in the past. It's a divided Congress. We have a president who has had somewhat lower popularity, who says he's running for re-election. He's heading into a presidential cycle. So as we move into next year, what are you watching for in the new Congress? What are sort of your big ticket items? Josh, maybe you could start.
Yeah, so I think there's a lot to watch. I think some of the early statements and by committee leaders will be really important to get a sense of where do they want to go. Their hiring decisions, their policy agendas, we've seen some of that forecasted from where committee leadership is not turning over, but I think it'll be really important to get a sense from some of those early steps for committees on what do you want to work on. I've been thinking about the shifts as, control of chamber is one, committee changes are another. I think this 117th Congress is the last Congress that we've seen that's probably likely to do major COVID legislation. Now, we could throw a big asterisk on that. Maybe we see another variant and we're back into kind of the acute phase of the pandemic at some point. But I think barring that, we're probably at a point where most of the major COVID legislation is in the rearview mirror. So that means that there's going to be a lot of focus on some of the items that Sonia and Ipsita talked about around mental health and some of the Medicare policies, which are very bipartisan, substance use disorder, behavioral health very broadly. But how members tackle that will be really important to start to watch what their decisions are. I think in the House Republicans, you'll see a lot of oversight, and that is one way in narrow majorities where they can drive a lot of attention, harness a lot of energy, and it informs policy. That's often seen sometimes in a vacuum, but I think what folks miss sometimes is that the stones that are uncovered in policy, in oversight, often inform where policy goes, and sometimes you don't know what is under every rock until you look at it. So I think the oversight committees and subcommittees will be active on the Republican side of the House.
Great, thanks. Sonia, you wanna jump in?
Yeah, I do. First, I'm going to ask, Josh, I think you're right in terms of COVID legislation being a rearview mirror, but I would put an emphasis on broad COVID legislation. I do know that I think all of us have folks that we work with whom are doing individual things related to trying to get therapies and other treatments in the stockpile, who are trying just to get them authorized and available, whether it's the broader diagnostics, so it's COVID and other things. But I think just putting that finer point on that, I think you're right. The big, broad CARES Act, all that type of broad-based large legislation is done. But I don't want us, and I know we to leave anyone with the impression that there's no more, diagnostic support out there. Because I think there is. It's just going to have to be done in a very fine tooth way. Everything you said, I think is absolutely right, particularly the oversight side. The one thing I'll throw in, and I know we might head there anyway, but the Inflation Reduction Act, the IRA, obviously the implementation of that's going to be a very big deal in terms of next year for health on the health committee. There's going to be a lot of work that's going to be done. A lot is going to happen in the Biden administration on the regulatory side. To Josh's point, not only do I think we're going to see oversight of general healthcare matters that the Republicans have long had on their list related to a variety of things, COVID's origins, the administration's response to it, but I also think you're going to see a critical eye towards the implementation of the Inflation Reduction Act as well. And the one thing I would throw out there, and not to be too provocative, but 2024, that presidential race and that tight House competitive race has already sort of begun, right? And so if you are, leading a health committee or anyone else in the leadership on either side of the aisle in the chamber, you're thinking about how to position your agenda, your members, your caucus in a way that's going to allow you to be competitive, not only at the top of the ticket, but also really again in that really competitive House, where again we're seeing that narrow Republican majority. Democrats are already thinking we can get it back in 2 years. How do we position ourselves to be able to do just that?
Yeah, great points. Sita, let me turn to you, and I do want to flag. I definitely want to come back to you on Inflation Reduction Act. I don't want to get too far down that rabbit hole just yet.
Sure. So then I will, 100% agree on the oversight, bringing in Chiquita at CMS, Dr. Caleb, FDA, Fauci, who, will be a regular world citizen. That takes that sucks up a lot of energy and resources, I would add, for the agencies, preparing for these things, responding to requests. So that's just one thing to keep in mind. Some other things we're looking out for, again, the regulatory agencies, we can pause on Inflation Reduction Act, but Medicare Advantage, we've got some risk audit regulations coming due by February 1st. Those are regulations that have been in the works for over 10 years, 12 years. This has to do with potential upcoding of beneficiaries to garner that additional risk-adjusted payment from the government. So RADV is affectionately what it's called, and then the 2024 rates in the first quarter finalized typically around April. Again, that's for 2024. Could be some interesting surprises in those. Certainly there's a lot of interest in MA with 50%, 50% of Medicare folks are in an MA plan. So it's pretty popular. And, 10 years ago, the grassroots group would go to the Hill and say, don't take away my Medicare. Now it really is, don't touch my Medicare Advantage. You get the vision, you get the dental, you get the silver sneakers. So it's very, very popular. Other things in no particular order, we talked about pandemic preparedness, Ballot Act, some of these issues. There is a must-pass vehicle in September of 23 for the Animal Drug User Fee Act. So you could have some of those policies that are, being worked out, refined, et cetera, with stakeholders potentially pass in the summer or fall of 2023. So I would keep an eye on that. And then last thing I'll just mention is deficit reduction. Typically about once in a decade, there is a come to Jesus moment about getting the fiscal house in order. We've spent, $7 trillion with a T on COVID relief, vaccines, additional payments to providers. So I would look out for that again, not as something in perhaps the next quarter or two, but something that potentially Congress can agree upon, some sort of framework. I was going to say super committee, but some kind of mechanism to
Trigger warning.
Spending. That too.
Is that not entitlement reform you're thinking, or you're thinking more in terms of deficit release? Because just thinking about it in terms of the context of healthcare.
I agree. I think, look, as long as I've been doing this work, which is a long time, the military never seems to get cut. But, providing a 2% haircut to providers across the board, why not? Sequestration happened and, nobody seemed to lose their shirts. So, I think there'd be no sacred cows. And again, you'd hit physicians, potentially hospitals, plans, everyone. And again, that's evolutionary down the road, nothing that potentially takes place in the next few months, but I think those discussions will come up.
To Sita's point, I do think you're going to start to see more Republicans talking a lot about the Medicare Hospital Insurance Trust Fund, where we have an insolvency projection of 2028 from the actuaries. We'll have the actuaries report next May, June, July, and that number could bounce around a little bit depending on what happens with payroll tax collections and our economic outlook. So I actually think it's a good issue spot that that will be something we'll hear a little bit more about. And just to build on the point made on animal drug user fee, thinking about some of the mess pass vehicles for next Congress, we do have the expiration of the Community Health Center Fund that will drive a lot of work in the Help Committee and Energy and Commerce. So as we think about, what will Chairman Sanders do? What will Ranking Member Cassidy do at the Help Committee? A lot of what they're going to work on is must-pass legislation for reauthorization.
Great.
Good point. Just to, and I can't let it, because you're right, Josh, the community health center piece. Keep in mind, both Sanders as well as Cassidy are really big fans of that. I believe Cassidy even has some sort of, personal ties to community health centers. So that really would be an area where it would be interesting to see how the dynamics come together and move forward in that respect.
Yeah,
And
so
just,
oh,
sorry,
go ahead,
Chris, I was
Josh,
just going to say before my coughing set, one other is the Pandemic All Hazardous Preparedness Act. So there will be a number of, HRSA programs as well, the Public Health piece, Community Health Center Fund. So that's a lot. And then there's some provisions in the Support Act as well that will be up for extension. Some of that will fall on the finance side, and some of that will be on the help side as well.
I'm gonna just pause. Anyone else? I was gonna ask about must pass legislation. You guys went right to it, so that's great. Josh, I wanted to ask you, and we've had a couple questions along this line, specifically as we're thinking next Congress. What are how are Republicans approaching health policy? What are their priorities? What are they thinking about? And maybe I'll caveat it with a comment that someone who may be on here, so I won't quote them by name, has made to me a few times, which is if Republicans are talking about health policy, they're doing it wrong. But nonetheless, that while it might not be a politically one of their focus points, what are their priorities, and particularly some of the incoming chairmen?
Yeah, so I think it depends on what Republicans you're talking to, right? So broadly for the House GOP conference, they'll look at the Healthy Futures Task Force. We've seen this kind of mechanism used by Republican leadership, at least in the House before, with Speaker Ryan and the kind of Better Way plan in 2016. That became a bit of a governing document in 2017, and there were some very big differences between that and I think where Leader McCarthy and his team are right now. But I do think when you think about some of the priorities, they went through a very deliberative process where they worked with the committees. They also pulled members off committee. They had listening sessions, a lot of feedback, and that is designed to bubble up recommendations and policy ideas, and then put that together in a coherent framework that's built out by specific domains around innovation and coverage and access. And I think what you'll see is a lot of that document get translated forward into bills that will move through the committees, and you start to see that kind of as a reference point. And so I think that's incumbent on stakeholders to kind of familiarize themselves with some of the policy ideas and the recommendations, and to the extent that they're engaging on those topics, I think that's important. But from the committee perspective, I think on the House side, we don't yet know the Ways and Means leader. I think for McMorris Rodgers, some of the things we've heard her talk about have been interest in authorization of NIH and CDC. So not just the oversight of those agencies as COVID, as Sonia mentioned earlier, but I think also authorizing those. Certainly a lot of interest in COVID and understanding the government's response and the impact. A lot of interest in telehealth. So if you think about there's a 1-year extension at the end of this year, we could easily be seeing another extension next year. I think Sonia was dead on. There'll be a lot of oversight of the Inflation Reduction Act. And I think another issue that may be less well appreciated, but a big area of focus for McMorris Rodgers would be helping individuals with disabilities live to their fullest potential. Very active in soliciting ideas from the Medicaid policy community, interested in ideas on home and community-based services, personal care services, a lot of these issues that I think were very bipartisan, and really interested in understanding where stakeholders are. I think that'll be a major focus as well. And I'll just finally say, Sonia has a great point about, to help clarify my comments, that the major things in COVID are done, but there's a lot of important work to harvest the lessons from COVID. And we've seen that in the Prevent Pandemics Act in the Senate. And I think you're exactly right that there are some things that we've learned from COVID that are really important, and it's time to continue to carry those through. And I think there'll still be bipartisan support for those.
Great, thanks, Josh. Sonia, if you think back to the start of the 117th Congress, I think the president, I think congressional Democrats came in with a very ambitious set of healthcare priorities, and hopefully at the end we can kind of circle back a bit on that and kind of how that played out. But as Democrats are now entering the 118th Congress, what are they prioritizing, and where do they focus, just given the reality of a Republican House?
Yeah, from the, are we talking specifically the congressional Democrats or the Biden?
Still thinking about congressional Democrats, I think. Yeah. Then we'll pivot over to the administration.
Sure. No, I think, there are a number of things that, that's why I think this lame duck is going to be so intriguing to see, what doesn't get done on their agenda that they're hoping to do that could be pushed into next year. And keep in mind, again, they have the Senate as well, but you're right, things getting through the House. So we've already talked about sort of the mental health stuff, the telehealth stuff, things that are particularly of interest to them there. There are a number of smaller cats and dogs around. Some of the things they've done in the ACA. I mean, we think about premium tax credits. That's something this administration has been pushing for and advocating for a very long time. Those are things that I think will still be top of mind. That's why I think it's going to be really sort of instructive to see what does and doesn't get done in terms of the lame duck, to see where they head into moving forward. But, I think for the committees themselves, it's going to be kind of interesting to watch. You're right, Josh, in that this task force that Republicans have put together that has their broad framework on where they want to lead on the healthcare piece, I think has, from a policy matter, hasn't been very strong on the specific instructions about where they're going to go. So I think particularly for Pallone and whomever, and for Richie Neal, and certainly they will take the signals from Catherine Morris Rogers, whomever takes the Ways and Means helm, to figure out where they want to go in health. But I continue to believe and know from conversations that they continue to be in a position where they're going to be aggressive moving forward on not only advancing the things they want to get done, but obviously moving forward with Biden priorities as well in this area. And it all gets back to expansion, access, affordability, coverage, and health equity.
Great, thank you, Sonia. Sita, I'm thinking I want to move more quickly to the administration side, because I think we have a lot of good audience questions, but I think we're just kind of a little tight on time. But one last question on this point before we move on, and maybe you can start here. Josh has alluded to some of this, Sonia, a little bit. Where do you see, given the fact that it is a divided Congress, where do you see opportunity for bipartisan legislating next Congress?
Sure. So I think I touched a little bit before on a few things, but I guess just to put a finer point on it, mental health, behavioral health, substance abuse, I think that's certainly something that we'll see over the next couple of years with some concrete legislation, I think, that could pass in chunks. So that's number one. Telehealth, of course, we learned the benefits of telehealth during the pandemic, and I think that will continue in some form or shape. Certainly bipartisan interest in that. Gosh, what else? I think value-based care, we haven't really talked about it yet. There's a demonstration out of CMMI called ACO REACH. It was rebranded earlier in the year, had been direct contracting. This is a program that kind of survived the darkness with a rebrand. There are some health equity components of the program, and then also some other refinements, but that program I think has some staying power. The Center for Medicare and Medicaid Innovation has a real desire to promote value-based arrangements. It's something that in health policy circles we've been talking about for 20 years, moving from fee-for-service to value. A lot of the stakeholders, some preliminary results were released last week. They're doing pretty well, so I think that's a theme we could see going forward, and with support, again, that's from the agency, but bipartisan support for, upside and downside risk, two-sided risk, value-based care more generally. A lot of the companies, by the way, are kind of leading the way here too. Agilon, Oak Street, a lot of these companies have gone public during the pandemic and really are providing a great service, finally incentivizing primary care. Bipartisanship, I think deficit reduction, is a conversation that's going to have to be had. Somebody on my team a couple weeks ago was saying that, typically deficit reduction does happen about once a decade. and with, what was it, a Democratic president and a Republican Congress. You know, we're in a mixed, divided Washington situation, but I would just keep an eye on those discussions longer term. And then one other thing I would mention is, don't forget about surprises. We always call the courts the third swimming lane. You know, you got Congress, of course, you've got the agencies with orders and of course regulations, but we've got a preventive health ruling coming out. Again, remember Justice Reed, I just called him Justice, Judge Reed O'Connor in Fort Worth, Texas, who has really challenged the idea that the USPSTF should be making recommendations about preventive services. And Americans, of course, have enjoyed $0 cost sharing and co-pays for those services. Well, that could go away. Impacts about 150 million Americans. So that's just a court case, a decision that we would watch over the next few months.
Great. Thank you so much. I think, just given time, I'm going to truncate this part of our conversation and pivot to the administration. Maybe start with you, Sonia, and then Josh, and then Apsita. I do have some IRA questions for you, but you know, we've talked a lot about Congress. As we think about the administration, as President Biden goes into a re-election cycle, kind of what are his healthcare priorities? How are they tempered or not by what we've seen in the midterms and the reality of the House? And where do you expect to see the most action?
Yeah, I think, and I think there is a hope that we're going to see a lot of action on healthcare coming actually out of the administration, given the divisions that we're going to see and that we have in Congress, and the lack of appetite, obviously, for Republicans in the House to be able to advance any of the key priorities that they don't agree with coming out of the administration. So I think we're going to continue to see a very aggressive posture. Again, a lot of it relates to implementation of things that have been passed. It's also going to be obviously focused on expansion of their of the ACA, the exchanges. Again, it gets back to our coverage issues and our equity issues. And I know we're not talking about IRA, but again, I think that if you've seen it with the No Surprises Act, obviously the implementation of that sort of coming to a final end. So I do continue to think that you're going to see aggressive posturing, particularly into 2024, with the idea being, look, you know, we're out of the pandemic, but not really, right? You know, we have these sort of dual heads that are happening, even coming up in the fall and the winter related to the pandemic, excuse me, COVID, the flu, RSV, mpox, and then we recently renamed monkeypox, anything else that can come up. They're going to obviously need to be reactory towards that, but also trying to advance their idea of creating as much opportunity for people to get coverage as possible. Obviously, with the redeterminations they're going to have at the state when the public health emergency ends, there's going to be a lot of work around making sure from this administration that folks are able to transition from Medicaid to either, you know, the exchanges or somewhere else. So I think you're going to see a lot of aggressive activity outside of the implementation of laws and making sure people have coverage and access to coverage in an affordable way. And obviously, you know, we talked about the CMS administrator. I know others as well, including the HHS secretary, very passionate, as I said beforehand, about health equity. It's been a longstanding issue, obviously exacerbated with the pandemic, and now that all eyes, particularly in Congress, on the Democratic side and other folks are really thinking about this now, I think it's time for them to be able to act on it as well. So those are some of, I think, the general areas of where they're going to head.
Great, thank you. Josh, sort of similar question. You know, where do you what is the regulatory outlook? What are you watching? Where do you think the most significant action is likely to be?
Yeah, Apsita flagged earlier the Medicare Advantage, both the reg and the rate notice. I think those will be very significant. We've seen them in potentially significant. They're certainly significant to watch. We've seen the administration 2 different times kind of think about ideas for Medicare Advantage related to plans being more accountable for social determinants and other kind of factors that are challenging for beneficiaries. If something there is finalized, I think there'll be a lot of interest there. You know, we have been watching the Medicaid eligibility and enrollment legislation. It's regulation, the proposed regulation. It's surprisingly probably not gotten as much attention outside of Medicaid circles as it probably merits, but it's a very significant reg, which would have significant implications on enrollment eligibility processes, and in many cases, making enrollment much more streamlined and consumer-centered, and includes just a lot of changes that stakeholders feel strongly about, passionately about, and I think in some cases, one of the, you've seen the leaders of the House and Senate committees for Finance and Energy and Commerce send an oversight letter to ask CMS a bunch of questions about some of their legal authorities in the rule and how they're implementing it, and what they're proposing to do, how they think about the kind of multi-billion-dollar costs it would be for states to bear. So, the power of the pen that an administration holds for regulations is very, very powerful. And I think Medicare rules, Medicaid rules, they can be very significant. And it's an area where, to Sonia's point around kind of coverage, expansion, access, and affordability, they can do a lot. And stakeholders will challenge some areas where they think they've gone too far. And I think that points to Sita's great point about there'll be surprises. Courts will have surprises. And I think also, we all know Congress is very fluid. We've seen them react to issues that suddenly become issues du jour. Whether that's something that has been building a while that we know is an issue, or just becomes a novel issue. And you think about insulin became an issue, has been an issue for a long time, but kind of became a very hot issue where a bunch of people were working on it. There's bipartisan interest. We saw the legislation earlier this year around firearm safety and mental health, where some of those issues have persisted for a long time, but with public events kind of drove Congress and there was action to happen. So keeping a category in our brains for surprises of things that could bubble up, I think is really healthy too.
Can I just add one more thing? I know Josh and I both talked about MA, RADV, the rates, marketing. There's third-party marketing organizations. The Finance Committee is very interested in this topic and launched an investigation. We could also see some more parameters, I think, around, again, these third-party marketers, which are a little bit nebulous. Some of them are, calls originating outside of the United States, and seniors are getting called 20 times a day at times, getting approached in the grocery store. I mean, things you wouldn't even imagine. So I think we could see more around marketing guidelines and impacting star ratings eventually. And then Josh, as Josh was talking earlier about this idea of oversight, right? Like you kind of start looking under the hood and you think you're going to go there, but then you end up here. I know that there are some members who want to look at 340B. We could see some oversight on the 340B program, which many would argue is in need of some updates. MLRs, what happens if we get rid of medical loss ratios? Again, not saying these things will happen, but at least kind of asking that question, gathering the information to understand the flow of funds and just provide some transparency at the very least, and then maybe figure out policy later.
And I would add PBMs to that list too. I mean, again, I think that's an area if you're going to go and think about broader drug policy, particularly and this is probably more in Josh's realm, but where do congressional Republicans go in terms of coming up with an alternative policy on reducing, prescription drug pricing and addressing an issue that they want to seem responsive to? I think, but I think again, that's just an area that we might keep an eye on.
So you guys have done a really good job of touching on a number of audience questions without me teeing them up. So we've got 5 minutes. I promised Sita I was going to ask her about the IRA, and I have one sort of question for Josh and Sonia. So we'll try to combine them and go fast. But the biggest question, I guess the way I want to do this is, particularly on IRA, does the House, how does the House flip impact implementation? And then kind of to Josh and Sonia, having been on the agency side, how does more broadly the increase in oversight impact the ability to do all of this regulatory work that we just talked about? And we're on the clock. Go, Sita.
Okay, so sorry, what was the question? I'm talking about IRA.
Yeah, so talk about how the midterms have impacted how the administration is likely to go about implementation and how we move forward with IRA.
Okay, sure. So IRA, yep. Let's see, this year coming up, 2023, we'll have the inflationary rebates kick in. And then on September 1st of 2023, per the IRA, we will see the list of drugs to be negotiated in 2026. So I think the sort of common thinking is that it's really the drug negotiation in B and in D that are probably the most onerous to industry. And we'll see a list of those drugs September 1st of 2023. So just kind of pointing out some catalysts in the year ahead. And then, to your point, the agencies are staffing up, and, this is a huge effort for them to restructure Part D. Of course, there's new liabilities in the initial and catastrophic phases, $2,000 out-of-pocket cap that kicks in 2025 versus 2024, which is when D restructuring takes place. So there's a lot going on there. And as far as the congressional makeup, I don't know how that really, if at all, impacts the IRA, truthfully. I think pre-midterms, when there was a prediction of a red wave, and by the way, we didn't really pay attention to a lot of the polling, but I will say that the question did come in that was, okay, can the IRA be repealed? And, my quick, gut reaction was, well, I don't see the votes for it, A, but B, remember, the IRA saves the government dollars. So if you're going to change it, repeal it, you need to offset that. Maybe I think industry has a decent argument with the 9 and 13 years around exclusivity and bringing that to parity. Again, that change might also have a cost associated with it and might be difficult to pass.
Thanks, Josh and Sonia. Kind of thinking about, and we'll make these our closing remarks. So we're just about at time, but thinking about the impact of that oversight on the regulatory agenda.
Yeah, I can go first, Josh, and just thinking about, and CETA did a great job of sort of highlighting sort of when things are happening and how the administration really has staffed up to be able to meet these goals. I don't think, and let me be clear, you're asking how the ratios have changed the ability to be aggressive. Well,
so as you have House Republicans take over, they're going to be pretty aggressive on oversight. Coming from the agency perspective, there's a lot of different regulatory initiatives that are ongoing. How does that oversight impact the ability to exercise that regulatory?
Sorry, Chris, I heard the question, but I was so many thoughts going at once there. I don't think it impacts it. I mean, look, this is for the Democrats, and particularly the Biden administration, a very big deal. They see it as a transformative deal, particularly on the drug pricing pieces. This is not going to impact how they move forward. And in fact, if you really want to be a little daring in terms of how some people might view this, you might say, if you're in the Democrats, congressional Democrats, the Biden administration, we passed this momentous bill. I'm going to talk about from their perspective right before the elections. We overperform. Perhaps this is validation that people like what we're doing, not only just on this particular bill, but in other ways as well. So I don't think people are going to be at all concerned. Now, obviously, from the mechanical standpoint, with additional oversight and perhaps even a much more aggressive posture coming from House Republicans on oversight about how they look at things, about how they're looking to make sure that the administration is meeting key dates, and they're hearing from stakeholders who are helping to influence the process and agitate the process along the way. They will need to respond to that. And having been in the building, and Josh may have a similar purview, that does impact your ability to be a little bit more aggressive in some respects than others. But I think on a policy side, from a policy angle, they don't wilt away from that. Perhaps instead they go a little bit more into the more of a, let's have a very communicative sort of view on how we talk about what we're doing, why we're doing it, and just, again, creating, I think, a much more of a favorable environment for the public to understand what they're doing and why they're doing to help counterbalance oversight questions and concerns that are going to come from House Republicans. Josh?
You know,
Josh, anything you want to add?
I think it's a great overview. I'll just say, you know, sometimes we think of oversight as red meat, and there will be some of that, I would expect, but I think there's also would expect, as Sonia was saying, these are big changes, transformative things that CMS has never done before for Part D or drug pricing. So there'll be a lot of kind of policy, legal, mechanical, operational questions on just understanding how does it actually work. And oversight will have both some of those kind of maybe more political questions, but a lot of the policy questions too.
All right, well, thank you all. Thank you for your insights. We are at time, so I think we will need to end it there. But I really appreciate your time. For the audience, let me just encourage you to complete the brief evaluation survey that you'll be receiving as soon as the broadcast ends. You'll also get an email later today. It's really helpful to us when we are putting these programs together to know kind of what's worked for you, what's been beneficial. So please do fill that out. And then let me also flag for you all that what I believe will end up being our last webinar of the year is scheduled for December 9th. That briefing, examining the social determinants of health and examining the social determinants of health, measures, evidence, and policy solutions, again, will be Friday, December 9th. So please do tune in for that. Recording of this webinar and all of the additional materials is available on our website. And so that concludes today's webinar. Sonia, Josh, Sita, thank you so much.
Anytime. Bye.
Bye.